Hi, I'm Dr. Chris Lewis, and I'm one of the chief educators here at Doctors in Training, and I'm here to go over the 3-question warm-up for the Foundations 2 video. Now, every video is going to begin with a short warm-up quiz that will review some of the high-yield material that was covered earlier in the course. Now, that's going to force you to learn actively, and it's going to help keep all of this material fresh in your mind as we get deeper and deeper into the course. So, if you haven't done so already, turn to the Foundations section of your study guide. And on the page for Foundations 2, you'll see the 3-question warm-up. Now, I want you to pause the video, try to answer those questions, and then restart the video, and I'll go over the answers with you together. First question, what embryonic structure serves as a secondary energy source? The answer? Endodermal yolk sac. Next question, what embryonic structure serves as a reservoir for non-specialized stem cells? That's going to be the endodermal yolk sac again. Next question, what are the 3 germ layers that derive from the epiblast? So this is going to be the ectoderm, the mesoderm, and the endoderm. That's it for the 3-question warm-up. Let's get to that lecture.
Welcome back. In this video, we're going to continue talking about some embryology, but we're going to focus primarily on teratogenesis, otherwise known as embryology gone wrong. Now, for the most part, we're going to talk about the embryological development of each organ system one by one as we get to the different systems. So we'll talk more about neurological development in the brachial apparatus in the neuro section. We'll talk about the embryology of the heart in the cardiovascular section. But I do want to highlight a few important dates that relate to organogenesis, just to give you some big picture markers. Again, weeks 3 through 8 is called the embryonic period. And this is the time when organogenesis is really starting to take place. So this is a crucial time period when the embryo is most susceptible to teratogens during organogenesis. Now, week 4 is when the 4-chamber heart begins to develop and when the 4 limb buds begin to form. So that's easy to remember. Week 4, 4-chamber heart, 4 limb buds. Week 8 is when we start to see fetal movement. Now, one student suggested that you remember that 8 rhymes with gait. And that'll help you to think about fetal movement. It's not like the fetus is walking around inside the uterus or anything, but it might be a helpful mnemonic for you. And then week 10 is when the genitalia begin to take on visible sex-specific characteristics. Now, the same student recommended that you write out week 10 as T-E-N, and then think of pen, P-E-N, which helps you remember penis. It's a little bit of a stretch. Also, make sure you know that these weeks are being measured from the day of conception. Now, in embryology, we're talking about developmental age, which is measured from conception. That seems fairly obvious, except OBGYNs in the U.S. keep track of gestational age. They count the weeks of gestation from the last menstrual period, not from the day of conception. So a 40-week gestational pregnancy in the U.S. is actually a 38-week-old fetus by developmental age. Now let's talk about some potential teratogens. We'll cover some potentially teratogenic drugs first, and then we'll talk about some other environmental exposures that can be teratogenic. And then last, we'll talk about some genetic things that can cause congenital malformations. So starting off with teratogenic drugs. Now, first aid has one list of drugs. Step Up has a slightly different list. So I've put together a list which is number 4 in your study guide with a few blanks for you to fill in. Now, none of these lists is complete by any stretch of the imagination, but this is a pretty good start. The first one on our list is ACE inhibitors, which can cause renal malformations. So we use ACE inhibitors to protect the kidneys in patients with diabetes, so it's pretty easy to remember that these drugs can also cause renal damage in the fetus. Next, we have 3 big classes of antibiotics that you should know about. First is the aminoglycosides like gentamicin, which can cause ototoxicity and cranial nerve 8 damage. You have fluoroquinolones like ciprofloxacin or levofloxacin. These have a theoretical risk of causing cartilage damage in the fetus and also in children based on animal studies. So we generally try to avoid giving quinolones in pregnancy, although there's not really good definitive data that these actually cause any problems in humans. And then tetracycline and doxycycline can cause discolored teeth in children. So in general, we don't give tetracyclines to children for that reason, and this could happen in utero as well. Then another group of drugs that in general are potentially dangerous are cancer drugs. So cancer drugs obviously interfere with rapidly dividing cells. That's a bad thing if you're an embryo that's trying to make organs. So cyclophosphamide and other alkylating agents can be particularly teratogenic. They can cause ear and facial anomalies, they can cause limb hypoplasia and absence of the digits. And then another cancer drug that's noteworthy for being teratogenic is methotrexate, which is a drug that works by interfering with folate metabolism, and that can lead to neural tube defects. We're going to see that again in neuro when we talk about the development of the CNS and neural tube defects like spina bifida. But the reason we give pregnant women prenatal vitamins that contain a large dose of folic acid is to prevent neural tube defects. So lock those things together in your mind, neural tube defects and folic acid. Anyway, one of the approved uses of methotrexate is to terminate an ectopic pregnancy. So obviously you don't want to give that to a pregnant woman who's trying to stay pregnant. And one other thing, you're probably inclined to say, gosh, if you're getting chemotherapy for cancer while you're pregnant, that's a pretty bad deal no matter what, which is true. But I just want to point out that both of these drugs, cyclophosphamide and methotrexate, are not just used for cancer. They're also used to treat inflammatory diseases like lupus, and psoriasis, and rheumatoid arthritis. So even though I've listed these as cancer drugs, that's not the only time you might see these used. The next few drugs in our list in the study guide are seizure drugs. Both carbamazepine and valproic acid are known for causing neural tube defects, just like methotrexate was. So if you have a patient with a history of seizures that's on one of these drugs, you want to make sure she's getting that folic acid supplement for at least a couple of months before she starts trying to get pregnant. And if possible, you want to get her off of the seizure drug while she's pregnant. Sometimes you just can't stop the seizure drug. Now, we used to recommend giving extra high doses of folic acid to these women, but that's never actually been proven to be beneficial. And then the other seizure drug to mention is phenytoin, which can cause something called fetal hydantoin syndrome. Now, Dr. Lewis is going to talk more about that in the neuro section when we talk about seizures and seizure drugs. Then lithium is used as a mood stabilizer in patients with bipolar disorder, but it can cause a cardiac malformation called an Epstein anomaly. We're going to talk about that in the cardiology section. Atorvastatin and other statin cholesterol drugs are contraindicated in pregnancy based on animal studies again. They haven't really been proven to be harmful in humans, but the FDA still rates statins as category X in pregnancy, meaning they are absolutely contraindicated. So statins interfere with cholesterol synthesis, which is really important for making a lot of steroid hormones and other things that a developing fetus needs. So there's a possible increased risk of CNS and limb abnormalities. Another category X medication is warfarin, which can cause a lot of different problems like facial anomalies, limb anomalies, CNS abnormalities, and spontaneous abortion. Now, you don't need to get bogged down in all these specifics of warfarin, but just know that warfarin is teratogenic. You should not use it in a pregnant patient. Now, which anticoagulant is considered safe during pregnancy? Heparin. Make sure you know that distinction. We're going to talk about that again in the hematology section when we talk about the anticoagulants in detail. Isotretinoin is a retinoid, a vitamin A derivative. Now, vitamin A is retinoic acid, right? Well, isotretinoin is also pregnancy category X because it causes lots of spontaneous abortions and a fair number of birth defects like skull and CNS problems, heart defects, parathyroid gland problems. So excess vitamin A can interfere with neural crest cell migration, and it can also interfere with homeobox gene or Hox gene expression. We're going to talk about the Hox genes and what they do in just a moment. There's a classic teratogen called diethylstilbestrol, or DES. It's so bad it was taken off the market. So children that are exposed to DES in utero are at a high risk of developing clear cell adenocarcinoma of the vagina much later in life, often in their teens and 20s, but sometimes as early as 7 or 8. Then the other big classic teratogen from the nobody uses this much anymore file is thalidomide. So thalidomide was a sedative that was given to pregnant women 50 or 60 years ago until it was found to cause limb deformities called phocomelia, which is where you have severe hypoplasia of the arms and legs. Now, do you remember the teratogenic drug that I specifically mentioned could also cause limb hypoplasia? Cyclophosphamide. So thalidomide can be used to treat leprosy, which is Hansen disease, but when was the last time you saw somebody with leprosy? And it's sometimes used to treat multiple myeloma, but that's usually a disease of older people well past childbearing age. So again, the category X drugs that we've mentioned are methotrexate, statins, warfarin, isotretinoin, diethylstilbestrol, and thalidomide. Now, there are some other category X drugs, but those are the most important ones you should know for your test. All right, next let's go over some other types of teratogens other than drugs. Now, some of these are kind of hard to control, but they're worth knowing for your test. Ionizing radiation like X-rays and CT scanning can definitely be teratogenic. We generally try to avoid X-rays during pregnancy, but sometimes you need them and you can't avoid them. Excessive amounts of vitamin A can be teratogenic, just like we said with the vitamin A derivative isotretinoin. Maternal diabetes can cause all sorts of problems like cardiac defects. We're going to talk about that in the cardiology section. Now, we're not talking about gestational diabetes, but women with pre-existing diabetes who then become pregnant. And then along the same lines, maternal iodine deficiency can cause the baby to be born with congenital hypothyroidism, which we call cretinism. Now, in this case, it's not the iodine that's teratogenic, it's the iodine deficiency that causes problems. Likewise, cocaine and tobacco smoke aren't necessarily teratogens per se. They don't interfere with organogenesis, but they do interfere with the blood flow to the fetus, so they can cause intrauterine growth restriction. They can also potentially cause some neonatal addiction to these substances and then some withdrawal symptoms in the first few hours or days of life. But then alcohol, on the other hand, is a major cause of birth defects. So let's talk about fetal alcohol syndrome for a moment. Excessive alcohol consumption, either binge drinking or lots of drinks on a daily basis, can definitely be harmful. We don't really know what would be a safe amount of alcohol to consume during pregnancy, so the Surgeon General recommends no alcohol at all during pregnancy. So what are you going to see with fetal alcohol syndrome? Well, there are some characteristic facial abnormalities with fetal alcohol syndrome, which you probably won't be tested on, but they include a smooth philtrum, a thin upper lip, and small palpebral fissures with wide-set eyes. Alcohol can also cause cleft lip and cleft palate, so lots of midline facial abnormalities. Fetal alcohol syndrome can also cause developmental delay and intellectual disability, what used to be called mental retardation. Fetal alcohol syndrome is actually the #1 cause of intellectual disability in the U.S. And along with that, you can have microcephaly, and you can also see something called holoprosencephaly. Now, holoprosencephaly is where the hemispheres of the brain fail to separate across the midline, and often it's going to be associated with facial anomalies where the facial structures fail to separate, and you can get a single midline eye. So again, it's another kind of midline facial deformity. So those are all the teratogenic drugs and exposures that we're going to cover. Now, I know this is a lot of material, so let's go to the whiteboard and review these in a slightly different format. All right, I want you to take out a piece of paper and write down these 7 different anomalies that I've listed over here on the left, and then we're going to try to match them to the various teratogenic drugs that I've listed on the right. Now, don't get lazy and just watch me do it. It's really helpful to go through the effort to write these down because it's going to force you to process this stuff using a different part of your brain. So the first one, we have cartilage damage. That's caused by levofloxacin potentially. Remember, fluoroquinolones hurt the bones. Discolored teeth can be seen with tetracyclines. Epstein anomaly, that's a cardiac anomaly where the tricuspid valve is displaced downward into the right ventricle so that the right ventricle is hypoplastic and the right atrium is abnormally large. We said that's associated with the use of lithium. Holoprosencephaly, remember that's where the brain hemispheres don't separate properly. We said that can be associated with maternal ethanol use. Limb hypoplasia, now lots of things can cause limb hypoplasia, but we mentioned it specifically with thalidomide and also with cyclophosphamide. Then spina bifida, remember spina bifida is a neural tube defect. We said that when you hear neural tube defect, I want you to think folate deficiency. But the drugs listed here that also cause neural tube defects are the 2 anti-epileptics, carbamazepine and valproic acid. And then the last one here is ototoxicity, which is due to aminoglycosides. And the only aminoglycoside we have listed here is gentamicin. So be sure you can recognize these drugs as teratogens and then know the problems that they're most likely to cause. And as a little treat for you today, I have a gold star. We're going to wrap up this video by talking about several genes that are crucial for normal embryogenesis and how mutations in these genes can lead to congenital anomalies. Actually, there's a huge number of genes. You could write an entire book on the genes that are important for embryogenesis, but I just want to highlight a couple of the more testable ones for you. The first genes I want to mention are the homeobox genes, or HOX genes. Now, there's a short section on the HOX genes in your study guide, number 5. Homeobox genes are the blueprints for skeletal morphology. They code for transcription regulators, so these gene products regulate the expression and transcription of other genes. Basically, HOX genes make sure that the skeleton is laid out correctly, so you don't have arms and legs in the wrong place. Now, there are some experimental models in which they've altered the HOX genes in fruit flies, and they end up growing legs on their heads where the antenna should be, or an extra set of wings and that sort of thing. In humans, mutation of the specific homeobox gene HOXD13 causes something called synpolydactyly. So poly is many or multiple, and then dactyly has to do with the digits. So polydactyly is when you have more than the normal number of digits on a hand, like the 6-fingered man in The Princess Bride. But then syn means together. So syndactyly is where you have fusion of the fingers, like Danny DeVito's version of Penguin in Batman Returns. So with this HOXD13 mutation, you have synpolydactyly. So there are extra digits, and then they are fused together. And we've already mentioned that excess vitamin A, or retinoic acid as a derivative of vitamin A, can alter HOX gene expression. So again, we don't give vitamin A supplements to pregnant women. The next gene to discuss is the sonic hedgehog gene. So there's a family of genes that was first discovered in fruit flies, and for whatever reason, they were named hedgehog genes. Then somebody got cute and named one of the genes Sonic Hedgehog after the video game character. There's also a cancer-causing gene that they named Pokemon until Nintendo threatened to sue. But this sonic hedgehog gene is expressed at the buds of the limbs in a zone called the ZPA, or the zone of polarizing activity. And kind of like the Hox genes, the sonic hedgehog gene is involved in organizing the layout of the embryo in an anterior to posterior direction, setting up which pole is going to become the head and which pole is going to become the tail, and then organizing all the points in between. So one thing you need to know is that mutations of sonic hedgehog can cause holoprosencephaly, where the hemispheres of the brain fail to separate across the midline. In severe cases, you have that single midline eye. Now, where did we see that earlier? Fetal alcohol syndrome will also cause holoprosencephaly. So sonic hedgehog is important for organizing the embryo along the anterior-posterior axis in the craniocaudal direction. There's another gene called WNT7, which is important for organizing the embryo along the dorsal ventral axis, so that your feet and your nose are both pointing in the same direction. And there's a gene called FGF that's important for limb lengthening. So FGF is fibroblast growth factor. So if you have a defect of the FGF gene, you're going to have short limbs. And actually, a mutation in the gene for the FGF receptor 3 causes achondroplasia, which results in, you guessed it, short limbs. All right, that's it for our video on teratogens. So go ahead and pause the video and answer the end of session quiz questions on your own, and then we'll go through the answers together. All right, let's go over the answer to the end of session quiz. First question, which antibiotics are potentially teratogenic? You have aminoglycosides, tetracyclines, which we said cause discolored teeth, and then fluoroquinolones, which can potentially cause cartilage abnormalities. Next, which drugs have such high potential for teratogenicity that they're classified as pregnancy category X? We said methotrexate, statin drugs like simvastatin and atorvastatin, warfarin, isotretinoin, DES, and thalidomide. And the last question, at what developmental age do each of the following events typically take place? So the four-chambered heart begins to develop. That's at 4 weeks. Remember, four-chambered heart, week 4. Genitalia begin to take on visible sex-specific characteristics. That's at 10 weeks. Fetal movement begins. Movement makes you think of gait. Gait rhymes with 8, so this is 8 weeks. And then limb buds begin to form. That's 4 weeks. 4 limbs, week 4. So that's the end of the end of session quiz. But just below that, you see this table called rapid fire facts. Now, we've identified almost 300 of the highest yield factoids and high yield associations, most common causes, buzzwords basically. Now, a lot of people will tell you step 1 doesn't test buzzwords, but honestly, if you know the buzzwords, it's going to save you some time in coming to the right diagnosis quickly, so that then you can answer whatever the question is asking about pathophysiology or whatever. So in some of our videos, after the end of session quiz, we'll have a handful of these rapid fire facts for you to jot down. Then later you can flip through these and cover up one side and quiz yourself, or get a study partner and take turns quizzing each other. These are great to go through at the end of the course, maybe on the last day before your exam. So let's go through these rapid fire facts. The most common cause of neural tube defects is folate deficiency. That's the most common vitamin deficiency overall in the U.S. The most common cause of congenital malformations in the U.S. is alcohol use during pregnancy. And the most common cause of congenital intellectual disability in the U.S. is fetal alcohol syndrome. All right, that's it for Foundations 2. I'll see you next time.